Well, it's easy to sometimes forget, but a good and well-kept set of chompers is essential to overall well-being. In fact, it affects everything from heart health to healthy lungs. Poor dental hygiene can even cause premature birth for some pregnant women. But how can you keep your pearly whites in tip-top shape? Well, in honor of Children's Dental Month, we asked Dr. Brian Novi to join us this morning. He's an assistant professor of restorative dentistry, has his own private practice. The American Dental Association gave his office an award for his preventive practice. Dr. Novi is here this morning to dispel the greatest myths when it comes to dental health for the entire family. Dr. Novi, good morning. Glad you're here with us.
Good morning. Thanks for having me.
I am like the tooth police. I'm always telling my kids, you gotta brush, you gotta floss, dental health, dental health. Why is dental health so important?
I think we forget that dental health actually relates to the health of the whole body. So if you have problems in your mouth, you're probably going to have systemic problems as well.
The other thing I always tell them, brush your teeth, and then at least, what, twice a day we should do it?
I say at least twice a day.
At least twice a day.
Definitely before you go to bed.
And I do that. I make sure we do it in the morning, we do it in the evening, so obviously it's important, but at the same time, you know, I'm always worried about cavities. What is it that causes a cavity?
Well, cavities are caused by acid from bacteria breaking down the teeth, but we forget that there are acids in food we eat, and so that acid also causes the teeth to lose those same minerals that the teeth are losing when you get a cavity.
One of the things that's important to me is they do not drink soda. I am not a soda mom, but I was reading something recently that it's not just soda.
Right. Actually, we have a big problem with sports drinks today. Those are worse than sodas.
You're kidding.
No, and fruit juice is bad too. So we always say...
Not the fruit juice, Dr. Novi.
Fruit juice.
Don't take away my fruit juice.
Well, I won't take it away.
Okay.
But for kids, like putting fruit juice in a bottle is not a good idea. And really, our kids should be eating the fruit and drinking water. But stay as far away from fruit juice as you can.
All right. We talk about fluoride in toothpaste. Obviously, it's important. What is it in the toothpaste for? What does it do?
Well, fluoride is a great mineral that can actually make your teeth somewhat stronger. But there's a lot of controversy out there today about fluoride.
I've been hearing a lot about that, seeing the reports about that. Tell me a little bit more about that.
Well, fluoride is safe, but we're probably giving our kids too much fluoride because they're using too much toothpaste. The amount of fluoride that kids should be using even isn't just a pea-sized amount. We call it a smear. Just a little smear of toothpaste on the toothbrush is all that you need.
All right, so when I let my kids brush their teeth by themselves, can you imagine how much toothpaste they're putting on their tooth?
They're probably putting a lot on there.
They are like the whole glob. So you're saying just like a little pea-sized?
Even less for a small child, yeah, a smear. Yeah, pea-size for a child, pea-size for an adult probably, but a smear for kids.
Okay, all right. So let's talk a little bit about demineralization. Tell me what it is.
Well, so when you get a cavity in your tooth or when acids start eroding away the teeth, they're actually losing calcium and phosphate, and we call that demineralization. And a lot of people don't realize that it's that demineralization or the loss of calcium and phosphate from the teeth that causes cavities.
All right, so how can we then kind of get rid of the demineralization, combat that, but then promote the remineralization?
Well, you've got to put back the same things that the teeth are missing. So if you just put fluoride on the tooth, that doesn't rebuild the calcium and phosphate that's missing. So we want to put more calcium and phosphate into our mouths, and that will remineralize teeth.
All right, and that's the product that we have here this morning. Tell me what we're looking at here.
Well, you're looking at MI Paste. It's one of the new products on the market for preventive dentistry in terms of preventing tooth decay. And what it does is it's just a topical cream. You just apply it after you brush, after you floss. Before you go to bed, it's the last thing that goes in your mouth. And then it actually super saturates the mouth with calcium and phosphate, and your teeth won't demineralize as quickly.
So this is preventive care?
It's total preventive care.
All right.
Yeah.
Now, how does it work? You just put a little bit on your tongue? Do you put it on your teeth?
Well, put a little bit on your finger. Put it on your tongue and kind of wipe it around your mouth, and I think you'll find that it tastes pretty darn good.
It does taste good, and I have to tell you, as a mom, that's important. If it doesn't taste good, the kids are not going to use it.
Yeah, I like to think that's kind of like creamy Jolly Ranchers.
It is. Well, there you go. Creamy Jolly. And if it doesn't taste good, you know they're not going to use it.
Right.
No matter how much we stress they should use it, they're not going to use it. One of the other things I wanted to talk about is when you talk about preventive care and you talk about taking care of your kids' teeth, what is the takeaway? What should parents know? What should we know with regards to taking the best care of our children's teeth possible?
I think the first thing to remember is as soon as that first tooth comes into the child's mouth, get them to a dentist. We love to see kids when they're young.
Which should be about, I think my kid got his about 8 or 9 months?
Yeah, 8 or 9 months.
Okay.
And by their first birthday, they should have at least seen a dentist one time, just so we can get an idea of what's going on and help you prevent dental problems, because that's what we really want to do.
True. You know, and what the other interesting thing I think our viewers out there should know is this is not a product that they can go buy on store shelves.
Right. So go into your dentist and have the dentist take a look in your child's mouth, and if we think this will work, ask, and feel free to ask about this. Say, hey, I heard about MI Paste. Do you think that's something my child can benefit from? And
how has the reception been? Are you finding that dentists are getting on the bandwagon? Are they aware of it? Are they using it?
I think dentists are. Dentists, we don't want to be known as the people that our patients don't like coming to see. We want to be the good guys and the good girls, I guess.
That is true. Well, this does taste very good, and thank you so much for sharing it with us on the show this morning. Can I take this one home? This is a cute. What is this? This is
yours to keep.
This is the one you like too.
That is melon MI paste.
Yeah, he's like, I love the melon.
I love melon.
All right, Dr. Novi, thank you so much for sharing this really good information with us on the show this morning.
My pleasure.
Good stuff. And if you want to learn more about that MI Paste Plus Dr. Novi was talking about, just check out the website. It's mipaste.com.